How do we mitigate COVID-19 or any other pandemic for that matter without completely crippling our socioeconomic activity? My name is Baruch Barzel. I'm the Network Science Center Director at Bar Ilan University in Israel. Our research typically deals with all sorts of networks, biological networks, neuronal networks, infrastructure networks, but of course, in the past couple of weeks, we've been directed mainly towards the spread of epidemics on social networks. And together we've come up with a strategy that we believe might be the game changer in terms of mitigation of pandemics alongside a reasonably active economy. So what is alternating quarantine? At a first step, you need to take the population and partition it into two groups. Cohort number 1, the red group, and cohort number 2, the blue group. And then these two groups, they alternate between work and quarantine in weekly succession. Let's see how that works. So cohort number 1 goes to work in week number 1, while cohort number 2, the blue group, has to stay at home. And then in week number 2, they switch. Now group number 2 goes to work and group number 1 has to be isolated at home. Now, before we understand why this works so well as a mitigation strategy, let's see what the benefit is. Well, of course, it shouts right out. You get a 50% active economy at all times. And every individual can be active at half of the time. So it only need to experience quarantine for a week at a time, which is much less stressful, both for the individual and for society as a whole. Now, it might sound a little bit difficult to implement, and there are two things to keep in mind here. First of all, we will talk later about implementation. It is much easier than it sounds at first glance. But the main point to understand is that the simplest thing to implement is a population-wide quarantine. If you want to exit strategy from that, or if we want something which is a little bit more reasonable, we have to inherently, by definition, take measured risks, and on the other hand, also implement measures that are a little bit more resolved in terms of the level of regulation of who can work and who cannot work. So there's no way to exit from a population-wide quarantine without getting into something which is a little bit more complicated to implement. But first things first, let's first of all understand why it works so well. And the way to understand that is to think about competing strategies that allow you a similar level of economic activity. For instance, the most naive strategy to get a 50% active economy is to have a 50% quarantine. In this case, you have group number 1 constantly staying at home under quarantine, and group number 2, 50% of the population, constantly going to work. It might sound a little bit unfair, but let's face it, most quarantines that in most countries have been imposed over the past couple of weeks, they were all pretty much like that, because in every quarantine, there was a select group of, say, 30 or 40% of the workforce that were active and did go to work. And then the remaining 60 or 70% were the ones to stay at home. So a 50% quarantine is just taking this one step further. Now, why does a 50% quarantine reduce the level of spread of the disease? The simple reason is because it dilutes the interacting population. Buses are half full, classrooms are half full, your office, instead of having 20 people, has only 10 people present, and therefore, since half of the population is active, the average individual only interacts with half the normal interactions that they experience on a daily basis. So by diluting the population by a fraction of 50%, you get a 50% active economy, and you also reduce R0, the sacred number, by a factor of 2. R0, we all remember, is the number that says how many people on average will you infect. If it's greater than 1, the disease spreads. If it's lower than 1, the disease decays. And this strategy reduces economy by 50%. It also reduces R0 by a factor of 50%. The other option to do that is to look at the time axis. You can also partition into two cohorts and then have everyone stay at home for 1 week and everyone go to work the next week. Once again, you get a 50% active economy, but this time you slice it along the time axis instead of along the population axis, and you again get a reduction of R0 by a factor of 2 because you've now diluted the interaction duration. People only interact for half the time because for 1 week out of every 2 weeks, they're all under isolation. So these two strategies reduce economy by 50% and reduce infection rate by approximately 50%. What happens in the alternating quarantine regime? Well, basically, it gets the best of both worlds. On the one hand, you partition the population into two roughly non-interacting groups. So you cut the population in half. But on the other hand, within each of these partitions, in each cohort, everyone works for a week and stays at home for a week, works for a week and goes into isolation for a week. So you also cut down the interaction time. You dilute both the interacting population and their interaction time. So what you get is a 50% active economy, just like in the previous two strategies, but now you have reduced R0 approximately by a factor of 4. This is a dramatic reduction that even in the worst case scenarios regarding COVID-19 seems to be sufficient. But there's more to that, because the weekly cycle solves another crucial problem that is specific to the current pandemic. You see, we were asking ourselves in our lab, why does COVID-19 spread so violently? I mean, at these days, everyone is very cautious. Nobody gets close to anyone that shows symptoms. So if you have a fever or if you have a cough, you are most likely isolated. Now, it's not an airtight isolation, but I would estimate that in most places, 90 to 95% of the people who have shown symptoms are under isolation, and therefore they barely contribute to the spread of the epidemic. But this virus has a weapon against us, and that is a latency period. See, from the time you get exposed to the virus until the onset of symptoms, on average, it takes 5 days. But you already start infecting others in a pre-symptomatic phase, which occurs a day, 2 to 3 days before the onset of symptoms. During this period, in the purple window here, during this period, you're an invisible spreader. You do not show symptoms, but you're already spreading the virus. So I can already be infected. Maybe you're already infected, and we're already spreading the virus, but I don't know to be cautious around my network. The people surrounding me don't know to be cautious around me. So it is these invisible spreaders that are the main contributors to the spread of SARS-CoV-2. But how do we isolate the invisible spreaders? Well, the simple answer is you can't, because they're invisible. And this is why we all entered a population-wide quarantine, because we are all suspected to be invisible spreaders at any given point in time. But the weekly alternation synchronizes with this disease cycle to actually selectively isolate precisely those invisible spreaders that are at their peak infection time. Let's understand how that works. Imagine that I'm an individual in cohort number 1. So in week number 1, I go to work. Now, I might have gotten infected during that week. And if I got infected on, say, day 2 or 3 of that week, within 3 to 4 days, I will reach my peak infection stage. I will have not developed symptoms yet, but I'm already infectious, so I am now at my most dangerous phase. But here's the point. According to the alternating quarantine routine, precisely at that time, after exposure, I enter isolation in week number 2. So I sit out my suspected incubation period while I'm at home. Now, during that week number 2, there are 2 options. If I really was infected in week number 1, I will most likely develop symptoms sometime along my stay at home in week number 2. Now, if I have developed symptoms, if I'm this orange guy right now, I'm no longer an invisible spreader. I know that I'm sick. If I have symptoms, clearly I need to get into self-isolation, and I cannot resume going to work when my shift goes back. But if I haven't developed symptoms throughout all of week number 2, after staying for 7 days at home, well, in that case, most chances are I was never infected to begin with. And when week number 3 arrives, I can resume my activity according to the alternating quarantine routine. So alternating quarantine works for 2 reasons. One, the major reason, it cuts R0 by a factor of 4, despite the fact that everyone is active 50% of the time. The second thing, specific to COVID-19, COVID-19 has approximately a 5-day, that's approximately 1 week of incubation period of being an invisible spreader. Well, the weekly shifts naturally synchronize with that to selectively isolate people precisely at the time of their peak infection, and therefore ensure a predominantly healthy population that's holding the socioeconomic activity. Now, in a perfect world, this cycle should have killed the disease within 2 weeks, because I might get infected in week number 1, then I stay at home. In a perfect world where everyone develops symptoms exactly 5 days after exposure, and in a perfect world where everyone abides by the rules, that means they go to work when they're told to go to work, they stay at home when they're told to stay at home. Under such perfect assumptions, within a 2-week cycle, everyone who was infected will develop symptoms and stay at home. If they did not develop symptoms, they're healthy, they can go to work, and therefore we kill the disease. But of course, the world is not perfect. And there are 2 reasons why the world is not perfect. The first, well, I just hinted at it, right? I assume that everyone develops symptoms within 5 days. Well, the disease cycle that I've shown you earlier is the average disease cycle. It's the characteristic disease cycle. But there is some level of variability across the population. Some people never develop symptoms. Approximately 30% will never develop symptoms. They're asymptomatic. So we will not know if they're infectious or not by the end of week 2 because they did not develop symptoms. Others take more than 5 days. If you take a week and a half or 2 weeks to develop symptoms, once again, we might miss you. You might leak out because if you were infected in week number 1, by the end of week number 2, you may have still not developed symptoms and you may resume working. So some level of leakage because of variability will exist. We introduced that into our model. You see, when we say that it takes on average 5 days to develop symptoms, there's a distribution. And we took the empirically relevant distribution there to make sure that we also account for people who develop symptoms early on, or people who develop symptoms later, or people who do not develop symptoms at all. So we implemented the complete disease cycle with the empirical levels of variability across the population. And with this imperfecy, let's look at the actual results. There's a lot to unpack here, so let's do this gradually. What you see here is the level of infection versus time. And in orange, you see the unmitigated disease. And as you can see, it goes way up above your screen. It crosses all the way up to the ceiling and goes back down. So we don't want to be there. But then at time t equals 0, set here to 50 days, but we can do it anytime we want. At time t0, we imposed our mitigation strategy. So let's look at the different strategies we examined. Remember the half quarantine, where 50% of the population stay at home and 50% of the population remain active. Well, that's what you see here in the red curve. It definitely lowers the rate of infection, but definitely not enough. You still see a very extended period of going up and then going down. Then we look at the intermittent quarantine, those weekly quarantine where the entire population goes to work 1 week and then stays at home for another week. And it's zigzagging like that in the turquoise curve because people get infected in the active week and then they recover in the isolated week. But as you can see, the results are comparable to the 50% quarantine because both of these strategies, what they roughly achieve is they cut our 0 by a factor of 1/2. But where's the alternating quarantine here? Well, alternating quarantine is all the way down here. It completely causes an exponential decay of the epidemic and helps us resume normalcy in a much shorter time scale than any one of the competing strategies, all the while allowing a 50% socioeconomic activity. Here's an interesting thing, you see, because when we say that a mitigation strategy is good or bad, we need to know what we're comparing to. So what's the baseline? Well, the baseline would be the ideal mitigation. And what would be the ideal mitigation? Well, imagine that you can impose a 100% quarantine where every individual is kept in isolation. Under these conditions, you would actually cut down the infection rate to absolute 0. Of course, this is only existing in theory. Nobody can actually do that. It's not an implementable strategy, but it does give us the mathematical bounds for what is the best mitigation performance that one can ever expect. The results you see because even under a perfect mitigation strategy like that, it still takes time for the disease to decay because the disease cycle of COVID-19 lasts for several weeks. It's a pretty long disease cycle. So the green line represents the absolute perfect mitigation strategy, the bound on your performance. And quite strikingly, alternating quarantine is not as good as that, but definitely in the same ballpark. So it is almost as if you ran a 100% theoretical quarantine. Now, we mentioned that the world is not perfect, and we only treated one imperfection, and that is the variability across the population in terms of the disease cycle. But the other challenge that we have, of course, is that in the perfect world, we assume that everyone abides by the rules. In reality, no mitigation strategy can allow that. And I have to say, we've seen many models out there, and typically people assume in the model that everyone does exactly what they're supposed to do. We know that that's not realistic, and therefore we added a factor of social conformity assuming that not everyone cooperates with the rules. Therefore, we added a fraction F of defectors, people who keep on being active all the time, both when they are in their quarantine shift and when they're in their active shift. And we wanted to see how much the defectors impact the performance of the strategy. What you see here is, again, the performance of our strategy under a 5% defection level, a 10% defection level, or a 20% defection level. And when we say 20% defectors here, we are really assuming a worst case scenario, because these defectors are 20% of the population that completely violate the rules, that completely ignore the regulation. They go to work throughout the weeks without regard at all to their quarantine shift or to their active shift. In reality, I believe the situation might be actually much more optimistic, because despite the fact that not everyone cooperates, typically defectors, they don't have the audacity to flat out ignore the rules. They cut corners. They go out a little bit. They get some stuff from the grocery, or they visit friends, or they go to get some fresh air, but they don't violate the rules at such level that we assumed in our simulations. So when we say 20% defectors, we actually mean a very, very severe condition of 20% people who completely ignore the regulations. In any case, what we see is alternating quarantine is rather robust against reasonable levels of social cooperation. So as we've been presenting this to many countries that were interested, and also to agencies in Israel that wanted to devise strategies for mitigation of the current pandemic, we understood that this should be more than a mathematical idea. So we put together a team with all the relevant experts in order to actually discuss how to implement this at a national level. And here are the basic implementation guidelines. The first thing to keep in mind is that when you make the social partition into two groups, that partition has to be based on households. That means me, my wife, and my children are all in the same cohort. Because if cohabitants, people who live in the same apartment, will belong to different cohorts, you'll start getting cross-infection. So the easiest way to do that, and maybe other countries have different systems, but the easiest way to do that in a universal fashion is that the local authority divides the population based on their address. This way you ensure that everyone who lives in the same apartment are in the same shift. There's an added benefit to that, because everyone knows their address, so everyone knows exactly what is their schedule, are they red or blue, but there's also another benefit, because if you think of people living in apartment buildings, then basing the partition on addresses means that everyone in the same building belongs to the same shift. And that makes sure that there's no cross-infection because of shared facilities. People in the same building use the same elevator, use the same staircase, maybe also help each other when someone is out of milk or needs to borrow some eggs. So all of these situations make sure that the same people in the same building do not cross-infect between different shifts. But how do we enforce it? So the one thing we want to avoid is policemen chasing citizens and looking at whatever shift they're supposed to be. What we do have are institutions for inspection to enforce regulations on businesses. So the idea is to get this done through businesses. Any business that is now working at zero capacity and wants to resume activity is allowed to reopen if they accommodate their work so that they work in two separate shifts. Businesses will be held liable to separating their workforce into shifts, into partitions that have no cross-infection between them, and working in weekly alternations. Now, there are going to be some conflicts, because I was just informed based on my address that I'm in my red group. And then I call my boss and I tell her, listen, I was assigned to the red group. She might tell me, that's nice, but I really need you in the blue group, because that other guy who can do your job is already in the red group. Well, that's fine. So there are going to be some conflicts. And the idea is that if you have these special conflicts, you need to solve them on a case-by-case basis. So I call my hotline in my local authority and I explain to them my problem, and they swap me with the other guy who had the opposite problem. So now I returned to the blue group and he became part of the red group. Now, if you're a computer scientist or a mathematician, I know what you're thinking. You're saying, okay, but this cannot be solved. There are too many constraints, because there are going to be constraints by my workplace. There's another constraint that me, my wife, and my children are in the same group. And there's just no way to get a perfect solution that satisfies all of the constraints. And here's the point. This is not a problem for mathematicians or for computer scientists, because we do not need a perfect solution. there's just no problem. If the cohorts are not going to be exactly 50-50, but one of them is going to be 47% and the other one will be 53% of the population, that is perfectly fine. It will work anyhow. You don't need an exact 50-50 partition. So my guess is that we can pretty much accommodate any special request. If anyone wants to shift from the red to the blue group, as long as he does it with all his cohabitants, that means his spouse and his children, there's just no problem to accommodate that request. And therefore, and this is important because if we want people to cooperate, we need to make this as accommodating as possible. So we don't want people to be stressed by the alternating quarantine solution. We also don't want businesses to be stressed because we want to get the economy as active as possible. And therefore, I believe we should be as lenient as we can in accommodating any special request because we do not need to have a perfect partition. Of course, the main question is, how do we create social cooperation? So we've shown that alternating quarantine is pretty robust against reasonable levels of defection, of nonconformity, but we're not interested in that. We want to maximize the level of cooperation. And when we think about that, the first thing that comes into mind is enforcement. But the truth is that garnering social cooperation, enforcement is really just the last resort. The first thing is that people should cooperate because they have intrinsic motivation to cooperate. They should understand why this is important. So any country or any municipality or even any workforce that wants to implement alternating quarantine in their own society, the way to do that is, first of all, explain to people. Create a video which explains why it works, why we need people's cooperation. People need to understand the merits of this mitigation strategy so that they willfully cooperate with it. So that is cooperation by choice. And it's a very powerful motivating force, but definitely not sustainable in the long run. I like to equate this to saying I will not eat the chocolate in the fridge because I know that chocolate is bad for me. It can hold for a day or two, but at some point, it starts to decay. Then the second way to create cooperation is by creating a framework that naturally leads people to abide by the rules. The diet analogy is just not having chocolate in the fridge. If there's no chocolate in the fridge, there's no temptation to defect. The last resort, of course, is cooperation by coercion. That's the enforcement. If I eat the chocolate, then a policeman will come and punish me for doing that. But that's the last resort. And now let's see how we can use these ideas of cooperation to make people actually abide by the alternating quarantine rules. So what are the inhibitors? Why would people not cooperate? So the motivations to defect, we've divided them into 4 different segments. First of all, you want to get some childcare or child support for your kids. You want to send them to school. You also want to go to work. So those are reasons why people might want to violate the rules during their week of quarantine. You also might want to get some supplies or get some services. You want to go to public institutions to get things done. And the last motivator to defect from your weekly quarantine is that you need some outdoors activity. You want to walk the pet, stroll with the children, or go to do some exercise. And these motivations, these inhibitors for cooperation, they are not all at the same level of risk. See, school and work are an extensive many-hour interaction. You sit in the same office or in the same classroom with many people for an entire day. Their infection risk is rather high. On the other hand, outdoors activities that are in the open air and are not necessarily interacting with any other people, the infection risk is very, very low. So they're not all created equal. And now, how do we drive people to cooperate despite these inhibitors? Well, let's start with school and work. The peak motivations for defection. Well, you can't do that, right? There's an organizational liability. Remember, your workplace is legally liable to work in shifts. You can't go to work if it's not your shift. You can't send your child to school out of cycle. They will not be admitted to school. School has a list of all the children that are supposed to arrive this week. If your child is not on that list, he cannot go to school. So when it comes to school and work, the prime motivators for defection, you just cannot cheat. There's no way to do it. So it's not a matter of motivation or enforcement. The framework just creates a natural cycle that directs people to stay at home. What about going to get supplies or services in the public center? Well, here's the first thing we need to appreciate. We are asking people to isolate, to quarantine for a week at a time. So it's not so difficult to get supplies for 1 week. So we need to direct people to get all their supplies in advance for 1 week. Now, of course, sometimes there are unexpected occurrences. There's a leak, the refrigerator broke down and all the milk got spoiled. There's an unexpected drug that I might need to get. So we should create, in every local authority, a task force for support that you can call. And if you have some emergency like that, some unexpected need that you could not anticipate in advance, they can help you with taking care of that. So you need to also create the relevant framework that allows people to cooperate in the smoothest fashion. And then the last thing that we can think of, if people still, despite all that, they want to go to the shopping mall to do their shopping in their quarantined week, well, there's an easy way to enforce that. Just create a mobile app. Now, I know people do not like apps that are issued by the government, but there are some things to appreciate here. We're talking about an app that is not going to spy on you, that doesn't read your emails and doesn't go into your bank account and doesn't care what are your searches in Google. It only knows one thing about you, and that is, are you in the red group or in the blue group? Whenever you want to enter a public institution, you're going to need to show the app upon entry. And if you're in the blue group and this is the red week, you are going to be denied entry. Well, the last thing we're left with is outdoors activities, and I have no way to enforce that without having policemen on the street asking people to show the app and seeing if they're in the red or the blue group. So yes, outdoors activities can only be avoided through enforcement, but the reality is that the infection risk is so low, plus people need outdoor activities. You can't keep kids or pets at home for an entire week. You should just let that go. That's fine. So together, we believe that it's very easy to get social cooperation for the alternating quarantine regime. But this made us, when we started thinking about this implementation, it made us rethink the whole strategy. Because you see, most countries, including Israel, have now experienced between 1.5 to 2 months of lockdown. And what we have seen is that a 100% lockdown, where everyone has to stay at home and stay quarantined, is not just impossible because it's hard to get people to cooperate. It's impossible because you really can't ask people to cooperate with this. People cannot cooperate with the 100% lockdown because you cannot get supplies for 2 months in advance. And therefore, supermarkets have to remain open. And supermarkets have a whole support around them. It's supply chains and truck drivers and so on. Hospitals, police force, army, those essential services need to keep working 24/7, and doctors need to eat and they need to get their medical devices. So a 100% lockdown for an extended period of a month or 2 months is just impossible. In fact, the data shows that even the countries that have imposed the strictest lockdown and the societies that have been most cooperative with the lockdown never exceeded a level of 70 to 80% reduction in activity, because you just cannot achieve any more than that without closing down things that are essential for people. On the other hand, in the alternating quarantine routine, you're only supposed to enter isolation for a week at a time. For 1 week, you can get supplies, you can get all your needs in advance. 1 week of staying at home is not such a challenge. So the alternating quarantine routine can really aim for a 100% isolation during that quarantine period. Because social cooperation, first of all, requires that you demand something reasonable from the people. You cannot demand a 100% lockdown for a month and a half, but you can certainly demand it for 1 week at a time. And therefore, intuitively, it might seem that a population-wide quarantine is the best strategy in terms of mitigation. But in reality, even the best population-wide quarantine is not perfect. So here's what you see when you take the infection levels under a 50% quarantine. We've seen that before, that's terrible. A 60% quarantine, 70% quarantine, you start seeing a true reduction in the number of infection. Here's a 75% quarantine or an 80% quarantine. So population-wide quarantines can at most reach this yellow curve of the 80% quarantine, and that completely cripples your economy. And where's the alternating quarantine? Well, it's the blue curve right over here. So alternating quarantine accomplishes approximately the same mitigation effect, somewhere between 75 and an 80% population-wide quarantine, but it doesn't completely devastate your economy. All the while, you still have a reasonable level of socioeconomic activity sustained, while you do not compromise at all the level of mitigation that you can get. So alternating quarantine is in fact a better strategy than a population-wide quarantine if you actually introduce the reasonable numbers. Now, some countries that I've been talking to have said, okay, it's a good idea, but it requires a lot of thinking on how we implement that. And it's just not the right time because we need an exit strategy for tomorrow morning. We don't have enough time to actually think about the implementation, the detailed implementation of alternating quarantine. Well, here's the point. You see, alternating quarantine is not just an exit strategy. It is a prime mitigation strategy. So this outbreak might already be decaying, but there will be future outbreaks and there will be second waves to COVID-19. And I think any citizen should expect their government to have a ready-made plan. So we improvise this time around, but by the next wave or by the next pandemic, there has to be a detailed plan on the shelf. And now is the time to make it. So that detailed plan might actually be to develop national level alternating quarantine capabilities. Now is the time to think about that. So when the next wave comes, we can right away come with this strategy that allows economic activity alongside COVID-19 mitigation and avoid the improvisation of a population-wide quarantine that cripples the economy and doesn't necessarily provide any mitigation advantage. So where do we stand right now? Well, we've been talking with all the relevant agencies in Israel and many different groups that were interested across the world. My group has been really working to provide simulations and to provide advice for all these groups that need it. And if you find this interesting, please make contact and we can try to see how alternating quarantine can work at your location. But really that's simple. So the results definitely suggest that it's worth considering, but there are several caveats to take into mind. Well, one, models have limits. Of course, this is all based on modeling, and every model has simplifying assumptions. Reality is full of spikes and sharp corners. Mathematical models are always rounded and nice, and even though we accounted for variability and accounted for defection levels, reality is always a little bit more complicated than the models. But that's the point here. You see, we never claimed any specific numbers. I never said that it will take 2 months or 3 months or that this will be the number of infections or that. Everything we have done is only comparative. We compared alternating quarantine to the alternatives. And in all of these comparisons, we were consistent with our model assumptions. So our models might not give specific predictions, but they're definitely sufficient to be comparative of different mitigation strategies that are all modeled under the same assumptions, typically worst case assumptions. There are other considerations. Many of the infections, especially if you impose quarantine, become in-house infections. Alternating quarantine does not solve that. It's a quarantine strategy. No quarantine solves infections in the house. In fact, quarantines typically exacerbate infections in the house, but they do try to make sure you do not get infected out of home and then bring the virus to your house. Alternating quarantine is a very good strategy to make sure there's no infections in the school, in the workplace, in the shopping centers, but it's not a good strategy to avoid infections in your house. You have to impose independent strategies for that, such as individual isolation in different facilities. Those strategies are hard to scale at a national level, but if you want to avoid in-house infection, those are the only options you have. Alternating quarantine replaces population-wide quarantine. It doesn't replace other measures that are aimed to make sure that people within the same family do not infect one another. Our implementation is in broad strokes, so it doesn't fit everyone. It just gives the idea. Of course, every country has its specific caveats, its specific considerations, its specific society and its specific business sectors, and every business sector also has its problems. So some people I talk to in the business sector, they say, oh, this is perfect for me. Like factories that have non-professional workforce can easily go into working in shifts because workers are interchangeable. But very professional workplaces where everyone has their own specific profession, well, for them, it might be a little bit more complicated. I can have two answers to that. Well, first of all, this is all about compromise. We want to mitigate the disease. So I'm not allowing you to grow, I'm allowing you to sustain. Even if it's not ideal, working 50-50 is definitely better than nothing. That's one thing. The second thing is that, as I said, this is the time to start thinking about this. This is the time to inform businesses that for the next round, this is going to be the mitigation strategy. So if you need to train worker A to do the work of worker B so that they can alternate in shifts, you should start doing that now. So we need to give businesses enough time to actually work out the details of implying alternating quarantine in their workplace. So is it that simple? No, it's definitely not that simple. But I think what is clear is that the merits definitely justify the effort. I hope you all stay safe and take care, and let's all try to resume normalcy as soon as possible.